An Indian study estimated the national burden of asthma at 17.23 million. On the whole, India is said to have 3 times higher mortality as compared to the global proportion of asthma burden. On World Asthma Day, we spoke to Dr. Prashant Saxena, Director and HOD Pulmonology and Sleep Medicine, Max Hospital Saket, to not only understand the disease but also know how it can be prevented. Dr. Prashant, welcome to eTimes Lifestyle. To start with, I'd like to ask you if you're seeing a surge in asthma cases today.
Yeah, so if you talk about recently, in the last 5 years or so, we have seen a surge in the cases of asthma, and not only in kids, across all the age groups. And the most
Okay.
important reason for these are not only the environmental changes like pollution and all, but also
Mm-hmm.
lifestyle. So that has also influenced us to a great extent. And kids
Okay.
are also suffering from asthma. And
Mm-hmm.
sometimes they are suffering from a disease which is known as reactive airway disease, which is like a inflammation which persists for a small time. And
Okay.
these patients don't really have asthma, but after careful evaluation, uh, they can be diagnosed whether they have asthma or they have some form of other illness.
Okay. So something that caught my attention was that you were saying more than the environmental factors, it's got to do a lot with one's lifestyle. What
Yeah.
exactly are you referring to?
So I am referring to a lot of pollution, which includes both indoor and outdoor pollution,
Mm-hmm.
passive smoking or environmental tobacco smoke. So
Okay.
nowadays kids are going to, parties, kids are going outdoors, they're exposed to
Mm-hmm.
pollution. In the indoors also, if somebody is smoking, or we have a culture where we use dhoop battis, agarbattis,
Right.
havan. So
Mm-hmm.
all these things are having dust and fumes and noxious gases. So they can
Mm-hmm.
influence the development of a child's lung, because the child's lungs are weak, they are under
Right.
development, and if you are exposing them to noxious stimuli, then these children can develop airway problems like
Mm-hmm.
asthma or some other problems. Not best, and they also have a high risk of pneumonia. Not even asthma, pneumonia also is higher.
Okay.
So,
Mm-hmm.
and going to clubs, sleeping late, and
Mm-hmm.
stress, and shifts, night shift works, coffees, lot of coffee, aerated drinks, all these things. Lot
Okay.
of people are using, the stored food, canned food
Mm-hmm.
with preservatives. Some people may have
Right.
allergy to these. So this is all a lifestyle which has changed drastically. And
Mm-hmm.
these are all important factors. Not only this, we have now a lot of carpets and use in the house. So
Right.
carpets, dust mites, these are also an important culprit in causing
Okay.
asthma.
Okay. So, doctor, is it possible that one can live with undiagnosed asthma?
The problem is that asthma is a episodic and intermittent attack of breathing difficulty
Right.
and wheezing, and
Hmm.
sometimes it can incapacitate you. You can even die of an asthma attack. So there is no way you can ignore asthma. Number one.
Okay.
Number two,
Mm-hmm.
asthma is a progressive disease.
Mm-hmm.
If you are not controlling asthma, it will be progressive, which means
Okay.
that the symptoms are going to worsen over a period of time, and then
Mm-hmm.
ultimately you may be crippled, or you may be having off days from work, or you may be having a life which is with disability.
Right.
So, treatment is 100% important. Diagnosis is 100% important, because asthma diagnosis, sometimes people are not able to diagnose asthma. And
Mm-hmm.
sometimes all the patients who have breathing problem are labeled as asthma. That is the biggest
Right.
problem with asthma. And
Mm-hmm.
asthma has got a specific treatment. And we
Okay.
have to counsel these patients, because, asthma is a disorder which is preventable, but it is not 100% treatable.
Right. Right.
So this has to be clarified to the person, that even if you are taking the treatment, you are symptom free, but please do not stop medicines without the doctor's advice, because it can recur. And
Mm-hmm.
I always quote, examples of famous cricketers and, even the US presidents who have been asthmatics, and they have succeeded in their life with the control.
Mm-hmm. Doctor, when we talk about prevention, what are the things that one should do to keep their lungs healthy and prevent asthma?
So, most important thing is avoidance of exposure, because, asthma is trigger based.
Mm-hmm.
Unless there's a trigger, you will not have an asthma. So trigger can be stress, anxiety, psychological disturbances, then pollution,
Okay.
environmental smoke, tobacco smoke, dust mites, cockroaches, pollens.
Mm-hmm.
Whether some people have asthma only during pollen seasons. So these all triggers have to be identified. Some people have allergy to food, but all this is easily identifiable, and
Okay.
you can counsel with the doctor, and you have to avoid. So avoidance of the trigger or allergen is number one.
Mm-hmm.
Number two, you have to identify whether you really have asthma or not. That is ultimately important. And then,
Mm-hmm.
if you have asthma, then you have to stick to the treatment plan which is given by the doctor. They may perform few
Okay.
lung function tests. They may
Mm-hmm.
tell you that you have to take this inhalers, you have to take these medicines, and you have to remove the phobias. There are many people who have phobias of inhalers. Inhalers,
Right.
if we take, they will become addictive. But we have to tell them that inhalers are a form of drug delivery. Inhalers
Mm-hmm.
give you relief. For example, if you are taking injection or tablet, but inhaler is another form of giving you a medicine, and which is only going to the lungs. So the side effects are very less as compared to tablets
Mm-hmm.
and injections. And then
Right.
inhaler usage has to be taught. Education is very important. Most of the people,
Mm-hmm.
90%, don't use inhalers properly. So that
Okay.
has to be stressed. I check the inhaler usage in every visit. So this is very
Okay.
important.
Mm-hmm.
Then
Mm-hmm.
if people have problem with the night shifts or work shifts or stresses, because in the night shift they need to be awake, and sometimes these people are drinking coffee, teas, and sometimes smoking also. I'm not saying
Right.
everybody does that, but these
Mm-hmm.
are important stresses or triggers which can stimulate your asthma. So we have
Okay.
to take care of that aspect also. So not only the history taking which we take, we also ask how the work is, how are you doing the night shifts. All these things we take into account.
Okay. Because you drew a very interesting comparison between your psychological health and occurrence of asthma, something that we don't talk
100%.
about much.
Because people are afraid of talking about it. Because
Mm-hmm.
stress, any form of stress is an important precipitator of not only the lung problems but of cardiac problems, of mental health problems, and even strokes. So mental health is
Right.
a big issue.
Mm-hmm.
And youngsters, they are so much involved in their work, and then whenever they are off work, they are partying, they're doing something or the other, they're experimenting
Mm-hmm.
with the new things. And for example, we have now e-cigarettes, which are banned, which is a good thing, but many people are getting it off label. So
Yeah. Yes.
they are now any in the cinema halls and everywhere you can see people in the corner. They are just taking a smoke, and they are using it. So these are also very important triggers of asthma because they contain, liquids which can irritate your lungs. And many
Okay.
youngsters don't know it. So
Mm-hmm.
they are taking it as if they are taking it for leaving the addiction or just for recreation, but they don't know that the constituents of the e-cigarettes or other vapes, which they call popularly, they can
Right.
affect the lung health very drastically. So then
Mm-hmm.
also that should be strongly discouraged. And even if it is banned, it is easy, people are buying it. So that has
Mm-hmm.
to be looked at. I mean, government regulations should be there. So
Right.
not on,
And
it's a
mhm.
multi-modality approach. It can never be one person.
Yeah. And another thing that we've recently started hearing is exposure to pigeon
Yeah.
excreta. That is also something that's affecting
So
lungs.
yeah, very important. Not only pigeons, any domestic bird, even
Mm-hmm.
pets, dog dander or
Okay.
cat dander, they
Mm-hmm.
can they are important triggers, including the furs. So they are
Right.
important
Mm-hmm.
triggers of asthma. So
Okay.
sometimes you have cotton blankets or fur blankets. They can trigger
Mm-hmm.
your asthma. Cats, dogs, pets, any pet can
Okay.
trigger it. And pigeons, and nowadays with modernization, pigeons are not so common, and they are
Mm-hmm.
only in the olden areas of Delhi or NCR.
Right.
Uh, but if you have balconies where pigeons are sitting, I have always advised them to cover the balconies and avoid this because it's an important trigger. It causes a problem which is known as hypersensitivity pneumonitis, and which is a
Okay.
progressive disease and which if not treated can lead to crippling.
Mm-hmm.
A patient cannot walk and it's a dreadful disease. So
Okay.
we do tell them about animals and pets and all these things.
Mm-hmm.
But we have to identify, blindly you cannot say, okay, you have pets, just throw them out. So this is
Right.
another very important point. The doctors and
Mm-hmm.
everybody should know that you have to identify the trigger. And nowadays we have got special tests, blood tests, where you can, just send an allergy sample and you can identify which allergen is causing the problem.
Mm-hmm.
So that
Actually,
is
that
usually
was
done.
my, yeah, that was
Yeah.
my next question. What are some of the definite tests for asthma
Yeah.
or lung
So,
infection?
yeah, I can tell you asthma is the clinical diagnosis number one. So you
Mm-hmm.
have to go into detail the history, everything, stresses, occupation, workplace,
Okay.
exposures, everything. So that has to be
Okay.
a clinical. And with the clinical probability, you can at least make out at least 80 to 90% of the times that this patient has asthma. Otherwise,
Mm-hmm.
you have a very simple test like spirometry, which is like a pulmonary function test, which is a blowing test on a
Right.
computer, where you can
Mm-hmm.
just we can just see your lung values and we can tell you whether it's asthma or not. And
Okay.
we have a special allergy test if you have problem with allergy. Sometimes asthma is not allergy based. So that is another important point, that most of the people say I don't have any allergies, but why I'm
Mm-hmm.
having asthma. So we
Okay.
tell them that even if you don't have any particular allergy, you can still have a trigger, which as I discussed, sometimes it can be
Right.
stress, sometimes it
Mm-hmm.
can be acidity or reflux. So
Right.
these small triggers are also there. So we have to
Mm-hmm.
just identify the trigger, and
Mm-hmm.
spirometry will tell us that this person is having a problem, and then we treat them with inhalers and all. And we
Mm-hmm.
have special tests also. Sometimes we look at blood tests with the allergy levels like IgE
Okay.
and eosinophil levels in the blood. And if the person is a smoker, we can do nicotine levels in the urine and the blood also. So that way you
Okay.
can identify whether it's related to smoking or it's
Mm-hmm.
related to asthma. Because both these patients can present with breathing problems.
Okay. Before we end this conversation, I would like to know what are the early signs that you feel people should, note and actually visit a doctor for a proper diagnosis.
So the early signs is intermittent chest tightness, wheezing, or shortness of breath associated with chest pain,
Okay.
and it will come in, a variable attack. It will be in the morning or evening. It will never be persistent. It subsides usually without treatment initially, but then it requires you to take inhalers and all, and
Okay.
it will happen in only particular places or particular triggers are there. Some people may have problem without identifiable trigger. But definitely, symptomatically, you have to be clear that if I am having a breathing problem sometimes, or I'm wheezing at night, I'm getting up in the night. Some people also have, a cough variant asthma. The
Mm-hmm.
asthma which does not has a breathing problem. This is another
Okay.
important entity, and another entity is exercise-induced asthma.
Yes.
And
Yes.
third is the pregnancy related asthma. So these three are very important. People can have exercise related asthma. Matlab ki when we are exercising, you develop a wheezing attack. Number
Right.
two is a seasonal asthma, which is only comes during the pollen season. Then
Mm-hmm.
pregnancy related asthma, which is due to the hormonal changes of pregnancy. These patients have pregnancy and they develop asthmatic symptoms, but they usually improve with the treatment. Same treatment is given for
And
everyone.
all three need treatment.
Everybody, I told you, asthma, if not treated, progresses and it can
Mm-hmm.
lead to a catastrophe.
Okay. Doctor, one more thing. What has COVID really done to the lungs? I mean, do you see post-COVID, do you see, like you just mentioned that there's a
So
surge of numbers. Hmm.
let me clarify this a bit in terms of physiology.
Yeah.
So COVID causes some structural changes in the lungs, some physiological changes in the lungs, like
Okay.
any other viral disease. But
Mm-hmm.
since it's an epidemic, we are talking only about COVID. Before COVID, there were flus, there were
Right.
pneumonias, there is tuberculosis, there's
Yes.
pollution-related lung problems. Everything is there
Mm-hmm.
in the society. But
Yeah.
COVID is just because we are speaking about COVID. But it's like
Mm-hmm.
any other viral infection which damages your lungs. Anything which
Okay.
damages your lung predisposes you to another insult which can happen in your lungs because your lungs become weaker with every insult.
Mm-hmm.
And
Right.
people who have developed a severe COVID, where you
Mm-hmm.
have a lot of changes in the lungs, your oxygen drops, then these patients are definitely predisposed to future problems like asthma, COPD, anything, TB, pneumonia, infections in the lungs. So it
Mm-hmm.
is not COVID per se. It is any
Okay.
viral or a strong infection which comes into your lungs and weakens it. So we have to take care of that. We have to remain healthy lifestyle. I mean,
Mm-hmm.
I know you will be asking this, but let me comment on that. Definitely,
Mm-hmm.
diet is very important. Drink a lot
Yes.
of liquids, at least 3 to 4 liters of liquid, which frequently we don't do, unfortunately. Then
Yeah.
fruits, citrus fruits, berries, they're a very important part of the diet. They should be taken generously
Okay.
because they are antioxidants, they're good for the lungs. Then juices should be taken, fresh juices, but not canned juices, which is another important point I want to make. And then you can have salads and vegetables at regular intervals because these keep your stomach full, they avoid you from eating absurd, and then they also prevent you from addictions. Because if you are taking meals regularly, water regularly, then the urge of smoking and all these things are reduced. So I
Right.
give these instructions to every patient of mine. And then a healthy checkup. If you have a problem with the lung, chest pain, anything, don't ignore it. Don't just assume that it's because of something, and just go to the doctor and get it checked. And that is
Yeah.
very important nowadays because we are a country which has got a maximum patients which are coming up with COPD, asthma, tuberculosis, pneumonias. So we are a country which is full of respiratory problems. So we
Right.
should be very much concerned about the lung health.
Okay. Thank you so much for taking out
Right.
time, doctor. And yeah, thank you.
Thank you. Thank you.